Thank you very much. My name is Yonas Zula. I'm a senior technical advisor to the state minister, and also I'm co-coordinating the Ethiopian collaborative action strategy. The national E-CAS coordinator is Lelisa Manuel. So I will be presenting, Ethiopian E-CAS impact story, what changed, what worked, and what what's next. So this is my presentation overview, and I will focus on three areas, setting the foundation where we started, demonstrating progress, what we have achieved, and accelerating impact, what comes next. When we talk about setting up the foundation, it's about where we started. Delivery of intervention to address the high burden of disease through the optimal effectiveness and efficiencies critical. As you know, the population of Ethiopia is, 130, around, 130 millions of Ethiopians are impacted by preventable disease. To the latest, around 2.9 million, zero-dose children are found in all cities and regions, and also the number and percentage of for the global malaria peoples which are risk for NTD deaths due to NCT, and also deaths when we disaggregate by age will also reflected in these presentations as you see. So generally according to our data and feasibility assessment, on average, there are around 40 campaigns per annum, per year, on average, 93% of which, are not integrated. And the reason why it matters is, non-integrated health campaigns often duplicate efforts, overburden health workers, and also it might bring, fatigue to the communities and also for the frontline providers. So as I have said, starting from 2019, 2025, an average of 40 campaigns were conducted. You can look at the data, and also when we look at campaigns by health interventions, polio is the leading, and also NATD will follows. I think many of the campaigns are, national, like 30 out of, 109 are, like national levels. There are also specific to regional levels. And from the regions, Oromia region is, the one who is conducting the separate campaigns. So the solution, when we talk about these fragmentations and also inefficiencies, the E-CAS Ethiopian Collaborative Action Strategy for the Health Campaign Effectiveness, it's a multi-year strategy that aims, catalyzing partners to institutionalize campaign coordinations and integration to enhance campaign effectiveness and also build a more effective and coordinated health systems. The potential for the catalytic effect is due to its embodiment of the one plan, one budget, and also one report strategy. The E-CAS it's developed by the five domains of the programs through the co-creations, which I'm saying the malaria, NTD, maternal and child health, which includes immunizations, nutritions, and also are the main like departments who are engaged, and also we do have the key partners and stakeholders, including the nature cancer centers and the Gates Foundations are part of it. The E-CAS should lead to better acceptability, cost saving, and also over improved program efficiencies. The anticipated outcomes of the E-CAS are far-reaching, as it is adopted, like from the global CAS strategy. I think the main areas are, reducing fragmentations and also increase coordinations. We also want, to make effective campaigns and efficient resources. We are also, anticipating, streamline approach, especially on the measurement, many, and also the learning areas. It also, timely harmonized funding process and, streams to decrease burden on the countries and also implement more effective campaigns. Uh, I mean, the final goal is, to transition the health campaigns intervention to the health care system, especially, to the primary health care levels. The anticipation also, the E-CAS will bring high quality, equitable, and also accessible and people-centered health services. This is, the SWOT that was conducted during the feasibility study. So I will not go, to the details. Demonstrating progress, what we have achieved so far. Just let me take you, the E-CAS, the Ethiopian Collaborative Action Strategy governance structure. We do have a national steering committee, which is led by His Excellency Dr. Dereje Dirguma, the State Minister for the Program and Service Wing. So he's leading, this NACC. This is a high-level leadership committee that provides, high-level guidance. It consists, members from the donor side, the partners, and also the main internal department actors from different lead executives, and also agencies like, from the supply chain side, EPSS and also EPHI. Next to the National Steering Committee, there is a technical working group, which is mainly, divided in three areas: the planning and implementation, the MERLA, and the campaign financing technical working groups. When you have an integrated campaigns, or we usually develop a national coordination teams for each specific campaigns, and we have a similar cascading of these national coordinations to the regional levels. E-CAS has achieved multiple milestones during 2024 and 2025. Ethiopia opted, in Q1 of 2024. We did a preliminary CAS customization workshop. We formed the National Steering Committee in SSC. We have also adopted the E-CAS from the global recommendations. We did the 2025 campaign mapping, and E-CAS implementation plans also developed. We hosted the Nigeria teams, and also the Ethiopian team also went to Nigeria for cross-country learning. We have launched the E-CAS integrated health campaigns in May 2025. Finance policy brief was developed, and also E-CAS launching event was conducted. We also conducted, the HC MERLA assessment in 2025. So the May 2025, integrated health campaigns adopted an integrated service delivery model, integrating three major health services. The first one is, under the integrated measles SI. We do have the measles vaccination, 0 dose, and under vaccinated children's. We do also integrated, COVID-19 vaccination, and the nutrition streams: vitamin E, supplementations, deworming, nutritional screening for children, and also pregnant and lactating mothers. Under the maternal and child health, sick child screening and linkage, obstetric fistula identification and linkage is also part of the activity. Multiple components were carefully incorporated to ensure overall success of the integrated campaigns. I think the coordination is the very important one, different layers of the national coordinations and the regional coordination, integrations of, trainings when we cascade. The advocacy, communication, and social mobilizations are also the the multiple component of the integrations. The other one is the critical area, the logistic and resource coordinations, especially the last mile distributions of important commodities and supplies are very important. The M&E sections, a multi-layered data tracking through the HIS2 systems, and also real-time dashboard via Google Studios are also was done. So what was done differently? Our learning in actions are clear practice shifts enabled by the E-CAS. That's the standardizations and the integrations. We introduced standardized criteria and tools to identify feasible integration opportunities. We also developed the first integrated national campaign calendar, aligning all priority programs. Leadership and coordinations. I think this is very critical. Starting from the NSC to the established a joint ideology that strengthens leadership, coordinations, and cross programs decisions are very important. Use of this digital transformation, institutionalized digital tools for planning, monitoring, and also providing rapid feedback loops are part of what we do differently. Innovative ways of working, promoted new ways of working, joint micro planning, integrated readiness assessment, and shared supervisions are also part of that. Alignment and impacts are strengthened alignment between the cost-driven actions and coverage improvements. The campaign impacts, the comprehensive coverage, as I will also present it, like later, we have reached, targets groups through integration approach, resource mobilizations, from different programs, the zero dose reductions, during that times, we have reached, around 27% of the zero dose, but after we conducted, we were able, to increase around 7% of, reductions in zero dose. And also, we also maintained, the coverage. I think the coverage for 2025 is 99%. Though the 2022 is, the same, but, the absolute number of, children, during the 2025 was, very high. And also, the susceptible children is, during the integration times is a bit higher than from the 2022. So this is, the comparisons of, the 2022 and also the 2025. In terms of coverage, it's almost, maintained. But as you see, the absolute number of, the coverage is, the 2025 is 4 million, more than the 2022, which is, the population size of, some countries. And it's not easy, like to deliver this, especially in a country where a diverse geography. The same is vitamin A, there is a 27 increment, and also deworming, there is a 25% increment. Generally, on average, campaign integrations, saves around 60% of project time when compared to the running standalone. Because when we integrated, it was 10 days, and also when it was standalone, it's 25 days. And the integrations are, one mobilizations for the logistics, simplified budget and payment, and also community, one visit for 5 service boosting uptake, and in terms of staff, higher productivity, lower cost. Coming to the challenges, some of the challenges are, denominator issues, budget areas, especially, integrating resources, proportionally from different departments, shortage of supplies, especially there was a delay, in vitamin E supplementations, and also due to the denominator issue, there are also some challenges, especially vitamin E areas. Delayed implementation, especially when there is geographical access issues, and also synchronization is very important. But 2 of our regions were delayed, for some reasons. High population movement, especially in the cross-border areas and also in the pastoralist areas are, common. Security, fuel and also some logistic-related operational issues, interruption of internet, and also data discrepancy, especially, during because we started the first time, we use the HIS2, especially for the middle size and a lot of around 80.5 million, data were uploaded to the system. So there we like some delays and also this discrepancy, which we corrected, later. E-CAS implementation has yielded valuable lessons that will guide future improvements. The first one is, coordination in the early planning, top leadership buying, drive, improve, the chances of the campaigns. The multi-month preparation leads to smoother implementations. Getting community trust, engagement of, influentials, community leaders are, very important. The use of digital tools, strong tracking systems with backup options are essential. Supervision and monitoring are also very important, especially the on-site presence, enhance accountability and decision making. These are, some of the pictures that we collected during the campaigns, and you can look at it, how the transportations, how the geographic difficulties, and also some of them, were given, through even to transport. We use, boats to transport, some of the logistics. What comes next? We have highlighted some of the E-CAS plans for 2026, operationalized specialized technical working groups for integrating, the campaign planning to formalize cross-disease collaboration, drive unified strategy, and also ensure expert oversight. We also launch, a nationwide CAS rotations and capacity building programs to systematically train, health personnel at national, subnational levels. We also want to do, develop an integrated campaign data hub within the existing systems. We usually use, the HIS2. We also use, some digital tools, especially for triangulations. Conducting joint cost efficiency analysis with partners in the MOH to quantify, the financial and impact advantage. Integrated campaigns, building compelling evidence-based, for sustained investment and policy adoptions. Formalized, knowledge sharing and advocacy plans to document, the Ethiopian CAS success, and also, disseminate lesson learned regionally. Also, we want to, champion the integrated health campaigns model as best practice for broader adoptions. So we did, our national campaign calendar for this year's, and we compiled around, 17 different campaigns from different departments, but we are, integrating, those that can be integrated or co-delivered. So we will have, the onchocerciasis and also might be lymphatic filariasis mass drug administrations. There's also schistosomiasis, and so most of our campaigns for this year will focus on NETD and also malaria areas. So we are looking, the areas that will be integrated and also co-delivered. So as you see the timelines, we want to do those major activities through the journey of the year. Campaign list for integration in Ethiopia. I think we did this, when before, we piloted, so immunization in VPD areas. We do have measles, OPV, HPV, yellow fevers. With regard to malaria, this the ITN distributions, environmental management, IRS. It also, mass fever testing, and also seasonal chemotherapy related activities. NTDs, the one that I mentioned earlier, and also from the nutrition side, mostly vitamin D warming and nutrition screening. And in the NCD sides are, one that mentioned here. Required action to be taken, this is the important area for the coalitions and also for the LET. Institutionalizations and framework. I think support institutionalizations and integrated campaign frameworks through technical and also financial assistance, especially ensuring the sustainability and also consistency across the programs. Global and regional coordination, strengthen coordination mechanisms to align timelines, harmonize tools, provide cross programs guidance that enhance efficiencies and coherence. Digital transformations, I think investing in real-time data system, dashboards, capacity building, and enabling evidence-based, decision making and also adaptive management. Financing and service delivery, I think mobilizing flexible funding to sustain integrated service delivery, strengthen supply chain resilience, and also expand outreach to underserved populations. Essential commodities and logistics. This is mainly goes to from the national up to the last mile distributions. The learning and adaptation and advocacy and sustainability are the required action to be taken by the coalition and also leadership teams. I thank you all. Hilda, I have finished my presentations. Thank you.